To bring to you today Dr. Munish Raizada. Dr. Munish Raizada is a neonatologist, pediatrician who is living in Chicago right now, and he is a man of many hats. But today we would want Dr. Munish Raizada to tell us about his innovative idea where he wanted to bring doctors together under one platform. So, Dr. Munish, would you like to come to the audience and tell us about your name of the startup and what you're trying to do?
Hello everyone, my name is Munish and I'm with Rajiv. We both are technically pediatricians and we used to work as senior residents in St. Stephen Hospital, Old Delhi, near 30,000. So we still remember those good days. MedBound HUB, as the name indicates, MedBound HUB. So medically bound, MedBound. MedBound HUB is a discussion forum which we launched about 3 months back. MedBound HUB is a discussion forum for medicals, medical students, dental, pharmacy, biotech, you name it, all kind of medical and healthcare students, and particularly suited for career counseling, networking, peers, kind of familiarity with each other, to discuss not only medical knowledge but also about career related issues, what can be done. It is a good place to find mentors, seniors, juniors, network. In medicine, as we know, networking and mentorship is of critical value. We learn from our seniors, juniors, colleagues, and this is a constant phenomenon. Medicine is a never-ending story. So you keep learning, you keep unlearning, you keep updating your knowledge. So this is what it is. So given that, MedBound HUB, anyone can join it. It is available on the URL called medboundhub.com. Very simple. We are also creating an app in coming days. At this point, it's best to be used on the web application or on the website or on the laptop, but on the cell phone also you can use it. As the days,
yeah. So one of the questions commonly people ask, what was the need? Why did you want to create a forum like this?
Yes,
So Dr. Munish has been a very highly experienced, well-traveled neonatologist and pediatrician. I'm happy, Gary. Hi, Gary. We are very happy that you guys are here, and we want to listen from Dr. Munish. What was the need to start this online forum?
Right, so we started a news portal, which is geared towards medicine and healthcare. It's called MedBound Times, MBT, MedBound Times, medboundtimes.com. So this portal was started about 3 years back, and we figured out that we also need a discussion forum where because many medical students, healthcare students come to us, they do internship at MedBound Times,
Right.
and there was a constant need for them to figure out what else can be done.
Right.
So we thought we'll start with MedBound HUB also,
Right.
which is a discussion forum. Yeah.
Right. So let's see. Let's listen from Dr. Munish. What does it include?
So you can see people are posting all kind of stuff. Anaphylaxis savior, EpiPen, as we know, this is of critical value. When someone goes into anaphylaxis, EpiPen saves lives. Non-clinical carriers after BDS, you can see. So people are discussing, the users are discussing, it's going well. We started about 3 months back, but at this point, many students are joining passionately, organically, and they're discussing all kind of things which they like. My internship experience at a fully remote setup. As you can see, this user has written about his or her experience in a startup, biotech startup, so you can see all this.
So what I understand is that there's a lot of chance of networking coming together.
Yes.
And then what is this here?
So you can see here, you can direct message. If someone gets direct message, for example, DMS. So Kashish has sent a message to Dr. Rajiv Nagpal. As you can see, welcome to MedBound HUB. So this is a welcome message.
Very nice.
From Kashish.
Right.
She is a relationship associate at MedBound HUB. Then you can see this is profile. You can create a profile settings, and here you can go. This is online activity.
So it's
online
like
presence.
a self-taking you platform, right?
Right.
It will take us there. Okay.
Right. So in coming days and weeks, you will see a new website being formed We are getting a new website made, for ourselves. This is good, but at the same time, we are getting
We
a
are
new
improving.
website.
Can you tell these categories, why you have put all the categories there?
Right. So someone is interested in joining the dental community. You can go to dental community.
Nice.
And you can see the latest posts and new posts, hot posts, which are doing well, top posts.
Right.
Similarly, if you are interested in MBBS, MBBS MD category of users, then you can network with them here. You can read the content from that particular category. Pharmacy, and you can see there are so many categories. So general, MBBS, dental, biotech, pharmacy, and MedBound Times. And then MedStar of the month. This is something new. Let's look at this.
Right.
So every month, Sonali Pradhan handles this. She is the program manager for MedBound HUB. So she and all other team members, Ritik, Jyoti, Kashish, of course. So they handle this, and they announce one user as a MedStar of the month.
Very nice.
So typically, the one who is very passionate about it, very active on the platform, teaching others, learning from others and giving back in terms of his or her perspective, knowledge. This is what we need. So MedStar of the month, I think this month they have already declared. Yes, so Dr. Sumbul she's an MBBS MD, anatomy. She was declared as MedStar of the month last month, I believe. And then
some amazing work by your students.
And then, of course, you will see this month also. I think they have announced.
So if you are a blog writer, if you're really passionate about bringing medical conversation at the forefront, I would recommend we come to MedBound. I think there are a lot of future plans. MedBound has, Dr. Munish is going to talk about how to volunteer, how to be a blog writer. I would want Dr. Munish to talk to you about it. But one thing I came to know through him is it's a global platform. It is not specifically for one part of the world, Asia, India, America. It's a global platform. So Dr. Munish, some of our students would be very interested to know how do you visualize what is going to happen in the future?
Right. So users are joining it, and as one can see, these kind of career-related, counseling-related things like how should I crack USMLE, what should I do for NEET PG, what should I do for PLAB, I want to go to Australia to settle down, what are the requirements for passing AMC, how tough is this exam, in pathology, what textbook should I read, these kind of practical issues people are joining.
Right.
People are discussing and joining. The future plan is very simple. Anyone can join this platform.
It's free?
Free to join.
Right.
And people can also, medical students and other kind of students, doctors, they can also do internships with us, content writing. Because ultimately it's all about communication. Communication skills are, one can fine tune, hone the skills, communication skills. So we do have internships for content writing or copywriting also.
Very
someone
nice.
who is interested in social media or, content creation about social media, video editing, everyone is welcome here. They can be part of this growing network.
So like a lot of students are very curious. So right now, Dr. Munish is sitting in Chicago. As you can see, this is the Chicago skyline, and we are sitting in one of the technological hubs here, where Dr. Munish is right now trying to let all of you students be part of his dream. His dream is to empower the medical community. He wants it to be free. Would you have any kind of content, like course content in the future? Are you thinking of maybe, you're a pediatrician, but public health or technology? What is your mission?
Well, we do have these kind of journalism certification course at MedBound Times. BOUND Times. So MedBound Times, as you can see. This is MedBound Times. As you can see, internships are here. So MedBound Times, as I said, is a medical portal, healthcare and news and views portal.
Right.
So medical students and so many other kind of healthcare students come to us. They are doing medical writing certification courses.
Right.
And at MedBound HUB, we also
So this is very interesting. Somebody wants to know more about your MedBound Times, actually. So you have articles all related to medical field?
Right, and look at doxcopy. Doxcopy is endoscopy of the doctor.
Very nice.
Literally speaking, we are trying to understand from that doctor
Mm-hmm.
what exactly he or she does, what kind of clinical issues, practical issues, practice issue, related issue they face. So
Right.
they give their perspective so that others can be.
So as we can
understood.
see, this is a neurosurgeon, Dr. Mayank Narani, and he has been able to write. So some wonderful posts are there, a lot to learn. I wish when we were in medical college, we had our networking forum like this. But never
Right.
late, as they say, whenever we have something. Dr. Sushila Nair, there's a biography and some amazing.
That
So a
you
lot
can
of work
see.
is happening.
So biography, profile of that particular professional, medical professional,
Mm-hmm.
it's done here.
Right.
So this is what it is.
So one more thing very good about this is that if you are a medical professional and you want to be featured here, is there any way they can be featured if they're
Yes.
doing something innovative?
Absolutely. Mail at medboundtimes.com. Anyone can send, an email, shoot an email. Himani Negi,
Mhm.
she handles the administrative aspect of this. Shubha is there, doctor. There are, other professionals also who handle all this. So yeah, so good platform for networking and, learning and, teaching others.
Thank you, Dr. Munish. I wish you all the best for this wonderful platform you have created. It has taken many years, as you were telling me. It's been your dream from last 4 to 5 years, I think.
3 years. Sir.
3 years, at least for 3 years, non-stop. A lot of innovation is happening, and I'm looking forward to the day when you is. What about your app? You have an app?
Right, so we are coming up with the app. So remember these two domains, medboundtimes.com. Medbound means medically bound. So medboundtimes.com and medboundhub.com.
Would it also lead to some job opportunities, as a lot of doctors are looking for job opportunities? Will you be training them, or would there be any kind of a job portal?
Yes, absolutely. In fact, at this point, we need an editor, medical editor, inform a doctor.
Mhm.
So yes, someone is interested. We do have opportunities and openings coming time and again. Yeah.
That's wonderful. Thank you, Dr. Munish. It
Thanks.
was wonderful.
Absolutely.
It was wonderful to have you here, and we will continuously try to know more about your innovative space. And everybody who has been here today, share this message and let this free community grow. And yeah, we become the best doctors in the world.